Thank you very much, Honorable Member for Woolly East.
Thank you very much, Honorable Speaker. I also rise to lend my support to this report. I think we are all monitoring the situation across the country in our various constituencies. Honorable Speaker, the report mentioned an expert opinion which revealed that over 181,000 people could be infected with the COVID-19 if the country fails to strictly adhere to the rules of social distancing. As an avid listener to media, especially external media, I can confirm this information. And if you go down in the same paragraph, if we had taken some care, we may end up with 53,000. But even 53,000 for a small country like this is too much. We should not even anticipate for that, especially with 1,000 beds. This is information that we must use to make decisions in this place. We know what COVID-19 has done to countries that have played down the pandemic. We know what is happening in Brazil. We know what is happening in the US. Thousands and thousands and thousands of people are dying. And they are not even counting those who are dying in their homes, because they are not even in touch with those people. Some of them even get to these health facilities, but they are not treated because they don't have any opportunity for treatment. So this is a serious matter, and I think we must accept that it is a serious matter, more important than anything else. So I will thank the Special Select Committee for the report. I think they have done justice to their mandate. Honorable Speaker, my concern is in the area of enforcement. I think there are a lot of challenges to ensure that the regulations are enforced. Many people have said some of the things that I've already accepted or agreed. For example, at the border areas, if the security did not have patrol vehicles, they cannot get to the borders on a continuous basis. And if they cannot get to the borders on a continuous basis, that means that there is no border closure. There is no border closure. In my constituency, I've not seen any border closure. I was sitting in one compound, and then, somebody came from Senegal with a stick. He said he is selling animals. But he's looking after, he was following people who came with some of his animals, and then he's following them to see them. So he came to the compound without any contact with any security at the border, and told the alcalde that I want to sleep here for the night because I'm following my people who have gone with my cattle. We are selling cattle. That person just crossed. So if there is no patrol vehicle, I don't see how, we can control the borders. And then somebody is recommending taking soldiers to the border. My other concern is the army properly trained to deal with this situation, to take care of the human rights concerns that we have expressed, to take care of our democracy concerns, reasonably justifiable in a democratic society? Are they properly trained to do that? Or within this short period, can we train them to take care of those concerns? That's something that I have. Honorable Speaker, the other concern is the issue of transport fares. I took it upon myself and joined a vehicle from Farat all the way to here. And then what is taking place and what is in the regulation are completely different. The issue of progressive review of the fares was discussed here, and the suggestion was to review it progressively to make it better, win-win. But they reduced the fares because it is anticipated that the fuel will be reduced. We've seen that the fuel has reduced drastically, but the fares went up. They went beyond even what was stipulated. They went beyond the normal, what we call the normal at that time. From Faratu to Westfield was $18. Now, when you join vehicle from Faratu, they will tell you by Yundum is $10. When you get to Yundum, they will say, because they are taking only, for example, seven passengers. So to get 7 passengers that are leaving Yundum to go to Lamen, it's very easy to have. So they will say $10 to Lamen. From Lamen, they will say $10 to Tabokoto. And from Tabokoto to Latrikunda, $10. Latrikunda to Churchill Town, $10. Churchill Town, Westfield, $10. By the time you get to here, you are paying $60 to $70. So that has completely defeated the regulation, the intention of the regulation. All the police are concerned is the number of people in the vehicle. I see them stopping vehicles for that. But I've not seen any officer interested in knowing how much fares are being used on the people. So that needs to be looked at. My other concern, Honorable Speaker, I visited the Edward Francis Small Teaching Hospital. And that day, it was an earlier period. Nurses were running away from people because they were not protected. They did not have any protective gear. So when people come to them, they don't know who is who. They want to run away from you. If you want to ask them, they want to run away from you. And we are told that they have stopped other cases, only emergency issues, that's what they will address. But how many other cases, apart from COVID-19 concern, how many other cases that we have? We have many patients living at home waiting so that when this period passes, they'll be able to come because they said they are only dealing with emergency cases. So I did not see an issue in that, in the report. And also, Honorable Speaker, we can look at our cases as very small. But how is the testing done? Are we testing? How many places do we have testing? How many people have we tested? I did not see that in the report. Maybe they did not have that report. So if you are not testing people, you will hardly have cases, and people may be dying, but you don't know why they are dying. And maybe they are suffering from COVID-19. You never know. So testing must be done. So if we wait for people to come and say, I am sick, how many people will come and say, I am sick, I want to be tested? We know Gambians. It will not easily be done. Honorable Speaker, the other concern is the private schools. We know government will take care of their teachers in terms of salary, but private schools are considering laying off their teachers because they could not bear the situation. They are closing. They have closed. And they were giving, some of them were giving 1,000 to their graduate teachers for the month. And now they are tired of that. So what do we do? And if they lay off these teachers, at the end of the day, even if the schools could open again, before they get all these teachers back, the students will still suffer. And I've not seen in the report anything relating to education. I've read the report. Maybe you can correct me if it is there, but I've not seen anything relating to that. What are we doing about that? We need to really take care of those teachers. If the schools are giving them, for example, 1,000, maybe the government can consider giving them another 1,000 to relieve them, to help them to keep up with these difficulties. But if you just leave them like that, they may disappear and go into other areas, which will create more problems for us in the future. Honorable Speaker, the report also, I'm not so aware of this special committee. I expect them to meet with the foreign affairs as well, because Gambians are also suffering in some other places. What has come out of that? Because we had the opportunity to meet the foreign affairs, so I expect them to also have some information on that, but they could feed the rest of the plenary. But I've not seen anything there, so maybe they could help us. Honorable Speaker, also, there was a very good initiative, which I see in some places. But my concern is that in the semi-urban areas like Farato and Nemakunku, which I always clamor here, they don't have water, even though pipes are all over around them, but they don't have water. And the NAWEC was putting tanks in some places. And these two places were highlighted, but up to now, there is no tank in those areas. And those people are suffering. So I would have thought that those deprived areas in the semi-urban areas could have been. I followed them until I got tired, and they said they will do it. But if you are in this situation, and then it takes you 45 days before you can get a tank, I don't see how that would help the situation. So I thought that would have been proactive method to really look into those deprived areas and give them, some of these remedies that would have helped. So on that note, I thank you for the time.